Hi, thank you for returning. My name is Robert. I'm a registered nurse, and this is a continuation of what to place on the envelope that's going to hold your loved one's medical history papers, things that you'd want paramedics and fire rescue to see instantly. If your loved one has an implantable continuous glucose monitoring device, CGM, insulin pump, or a percutaneous endoscopic gastrostomy PEG tube, right abdomen followed by a colon, and indicate if it's located on the left or right side of their abdomen and the date it was inserted. If instructions exist, include these with their medical history papers inside the envelope. If your loved one has and performs peritoneal dialysis, which is typically done daily, date its location on the abdomen, its insertion date, and state underneath in parentheses, see peritoneal dialysis instructions inside the envelope. If your loved one is to stay in the hospital, a recommendation is to bring in their own peritoneal dialysis machine to see if it can be used, since most hospitals do have certified nurses who can assist in performing this task. Continuing with the abdomen, indicate if your loved one has a colostomy or ileostomy. A colostomy is normally located on the left or middle part of the abdomen, where an ileostomy is on the right. Write which ostomy it is the location on the abdomen, the date it was inserted, and underneath in parentheses, write either C colostomy or ileostomy instructions inside the envelope. Again, if your loved one is to stay in the hospital, bring in your loved one's own ostomy supplies, which may be reviewed by a hospital certified ostomy nurse. Write back followed by a colon if your loved one has difficulty sitting up straight, wears a back brace, or a transcutaneous electrical nerve stimulation TENS unit related to pain issues. Next, write arms followed by a colon. Indicate, and in which arm, if your loved one has a midline or peripherally inserted central catheter or PICC line in place, which may be used to receive intravenous medications outside of a hospital setting. And so, right next to it, the word since and the date it was inserted. If your loved one wears a Duragesic patch that can be used to help control pain, write Duragesic patch, interchangeable arms, changed every 72 hours. If they wear a Nicoderm patch used to help with smoking cessation, write Nicoderm, interchangeable arms, changed every 24 hours. If they wear a glucose monitoring device sensor that can help track their diabetes, write the name of the glucose monitoring device, interchangeable arms, changed every 7 to 15 days, dependent on the model used. If they have weakness in a particular arm or arms, indicate that. If they have an arterial venous AV fistula used for dialysis, state which arm, since when surgically done, and what days they received dialysis treatment. This next part, which would include the AV fistula information, is extremely important. And if you feel you're running out of space on the front of the envelope, place this higher up above the chest information if so needed. If your loved one was instructed by their doctor not to use a certain arm in relation to a history of having on that side a mastectomy, a lymphodectomy, new or old AV fistula, write in dark, big letters, do not use, state that particular arm, for, followed by a colon, and in parentheses next to it, write IV insertion, blood pressure, blood draw. Underneath this, in parentheses, write the word reason, followed by a colon, and state the reason why. By doing so, you just prevented a significant error that could have occurred, and paramedics and fire rescue medical staff will love you for it. If your loved one has weakness in their wrist or fingers or essential tremors, which leads to difficulty grabbing objects such as a cup or dining utensil, write hands followed by a colon and indicate if it occurs in one or both hands. Following this, if your loved one has a urostomy due to a neurogenic bladder, write groin followed by a colon and indicate the date it was surgically inserted. If your loved one has performed daily catheterization to remove urine, indicate this and how often a day and since what date started. Underneath in parentheses, write C, self-urinate catheterization instructions inside envelope which would entail the care and size of the catheter used. If your loved one is not the person who does the self-catheterization, list the name of the person who assists them and their relation to your loved one and telephone number. Right legs followed by a colon if your loved one has trouble standing, weakness in one or both legs, has a prosthetic limb, or wears a leg brace. If your loved one has what's known as foot drop, which is the inability to bend the foot backward towards the body, making it difficult or nearly impossible to walk, right foot followed by a colon and indicate if it's in one or both feet. Lastly, related to the body, starting from the top of the head and working downward, state if your loved one currently has any wounds present. Pressure injuries are wounds mostly found over what's called bony prominences. They can range in stages from 1 to 4 and unstageable. Stage 1 are pressure injuries where the skin is intact, but the area is reddened and non-blanchable. Stage 2, which can appear as a sore, blister, or abrasion, is where skin tissue is open but not deepened. Stage 3 is where deep fatty tissue can be visibly seen, and stage 4 is where tissue loss exposed can show underlying muscle, tendon, or bone. An unstageable pressure injury is when deadened tissue known as iscar or the presence of froth obscure the wound, making it difficult to stage. But not all wounds can be labeled as a pressure injury. Arterial or venous insufficiencies, diabetic foot ulcers, neuropathic or non-healing surgical wounds are types of wounds not categorized as pressure injuries. Upon listing the wound and its location, state next to it what type of pressure injury or non-pressure injury it is, since what date, and once finished underneath, in parentheses, write, "See wound care instructions inside envelope." Wound care instructions should include the name of the doctor handling the wound care, their address and phone number, a wound care nurse if involved, their direct phone number, and how each wound is treated and supplies used. If so desired, include a current picture of each wound inside the medical history envelope that can be used for comparison by a medical staff member or hospital-assigned certified wound care nurse. Please review with your loved one's primary doctor. If your loved one uses a device to assist with walking, write ambulation followed by a colon. If they use a cane, indicate which side of the body they use the cane on. Write if they use a walker, scooter, or wheelchair, and if your loved one is labeled as being chair-bound or bed-bound. To end this session, if your loved one is a diabetic and is insulin dependent, write diabetes followed by a colon. Write insulin dependent diabetic, the name of the insulin medication used for coverage, and underneath in parentheses write "See diabetic instructions, including sliding scale, inside envelope." Finally, I want to take this opportunity to thank you for watching my presentation, and I apologize for the abundance of material covered. Basically, these are just generalized ideas on what to write on your loved one's medical history envelope for paramedics and fire rescue to see instantly, as well as medical staff in an emergency department of a hospital, rather than the front of the envelope being left blank. Again, thank you for watching, and may you find this of use for you and your loved ones.